The case that comes to mind to me first and foremost is a woman. She's in her 50s, and she a triathlete. I mean, really, she's a very active person. And she came in about a year after a rear end auto accident, a pretty good one. She had pretty severe whiplash. But immediately following that accident, she started getting tremors in both her hands and her lower limbs. And they were pretty profound. I mean, she couldn't even write without scribbling all over the page. And so we did a thorough exam. We went through everything, and she had her first alignment. We actually did a video of this where we looked at her hands. She had her hands, and they were really tremoring. I mean, you could really see, you can see her feet and everything, her legs tremoring. And we were able to, after the adjustment, we took another look, and the tremors were almost gone. This is 10 seconds after that atlas alignment. And it took her a while to hold. We ended up doing some advanced imaging. And nobody before could tell her. They were checking her for Parkinson's. They were checking her for epileptic seizures. They were checking her for MS, all sorts of things. And everything came out normal. Well, now knowing what I know, being in the diplomate program, it was wonderful to see not only her changes, but I was able to tell her why this happened. Because we did advanced imaging and the knowledge that I have now, I was able to show her that all those MRIs she had previously that were normal, well, there are issues there that weren't actually told to her. And now she knows why. So giving her that dignity of a diagnosis and understanding her role in making sure she stays in alignment, she has her life back now. The tremors are gone. She's back to exercising the way she should, and her life's back. Another case, a very recent case for me, was a young 15-year-old cheerleader. She's been diagnosed with a concussion, but they believe she had up to 7 concussions. This is a 15-year-old. She had episodes of not knowing where she was at, headaches, migraines, depression, anxiety. I mean, you name it. It was pretty profound for her. And by the grace of God, I actually met her mom at a health fair. And we started talking, and she goes, "Oh my gosh, I think you can help my daughter." So the day before she came to our office for her first examination, they had just left one of the premier concussion centers, pediatric concussion center, everything. And the only thing that they gave her was a list of 3 prescriptions for anti-anxiety and depression medications. That's the only avenue they gave her to do anything. And the mom was like, no way. We're not going that route. So they immediately showed up in our office. And after her first alignment, everything started to change for her. The brain fog lifted. She came back again. She was out of alignment again. She didn't hold but longer than a week. And we got her adjusted again, and everything lifted. And now I believe she's been holding now for up to 6 weeks, and everything's back to normal again. So one area, all they had was drugs and more drugs. And something as precise as Upper Cervical Chiropractic Care changes a young girl's life.